Peanuts, tree nuts, fish, shellfish, egg, wheat, soy, and milk. 90% of Americans have allergic reactions to these 8 common allergens. According to allergist and immunologist Dr. Hamsa Subramanian, the incidence of food allergies is on the rise.
There is no real age for food allergy. We see newborns, we see babies or infants when they're started freshly on solid foods or milk. You see teenagers, you can see an adult. So there's really no age. It is more prevalent among the children, but you can have or you can develop food allergies at any age.
There are still unknowns when it comes to the reason why.
So many foods are available, we don't know how they are manufactured, we don't know how they are grown. And generally, I think the immune system also is changing because we have become a clean society. It's called the Hygiene Hypothesis. The immune system does not now have to fight with bacteria, parasites and fungi that it was doing even 20, 30 years ago because we've become a clean society. And the immune system is literally changing right now. I guess it's evolution.
The public's awareness of food allergies is more prevalent in this day and age.
Schools have become aware, babysitters have become very aware, school nurses are being educated. There is a lot more support at this time than we had even 10 or 15 years ago, which is wonderful.
Dr. Subramanian says it's important to realize not all symptoms and issues caused by food are allergies.
I think the best example is wheat allergy. So there is wheat allergy, there is gluten sensitivity where people are not able to digest the gluten, gluten disease, which is the celiac disease, which is a totally different manifestation. But in all three, a patient is asked to eliminate wheat and other celiac products. But what it causes to the body is different. A wheat allergic patient may have anaphylaxis. He or she may die if they consume wheat. A celiac disease or a gluten disease may cause other problems. They may have arthritis, they may have autoimmune manifestations, they are more prone to lymphoma. Whereas a celiac sensitive person, digestion is a problem with wheat. So food can give you any symptoms, but you have to define what disease it is causing because you need to know the consequence of that disease, and that's very important to distinguish.
If there's any suspicion of allergies, she says people need to consult a physician before trying to fix any issues on their own.
Certain symptoms are very obvious. If someone has anaphylaxis, your lips swell, you have itching, you have hives, you cannot breathe, it's a no-brainer that you are having a reaction. But other reactions, sometimes subtle reactions, people don't want to talk about it, like rectal itching, could be a subtle sign that something is going on with the food that you're consuming.
So how do medical professionals like Dr. Subramanian determine if a person has allergies?
So a board-certified allergist has certain guidelines. The first is a very good history, and often we tell people to keep food diaries. So they write down what they ate, they wrote down their symptoms, and we often look at it and see if we can first find out what food groups are causing a problem. So a good history is a very good tool to start off with a diagnosis. The second is skin tests. There are very good skin tests, standardized skin tests for most of the allergens, but for not all. And then the third is blood tests. So we do blood tests in certain people. Blood tests have to be interpreted very cautiously. And then the last step that we would do is an oral challenge. We bring patients in when the patients say, skin test is negative, but I still cannot eat this food, we do an oral challenge. The most important role of an allergist, once we diagnose food allergies, is to counsel the patient for appropriate nutrition. For example, if I tell somebody you're allergic to milk, that's the easy part, but I have to tell them what supplements are available to supplement calcium and vitamin D. So counseling is extremely important because you need the appropriate nutrition. Whether it's a growing child, whether it's a pregnant woman, whether it's an adult who we are worried about osteoporosis, whether it's an older person, substitutes, appropriate nutritionally valuable substitutes are a very important part of counseling because anybody and everybody needs a balanced diet, whether you don't have allergies or whether you have allergies.
Along with heightened awareness on this subject come numerous opinions on the topic via television, blogs, social media, and more. Dr. Subramanian says anything the public hears or reads needs to be taken with a pinch of salt. It's important to make sure the information accurately fits each individual.
Every patient is different, and I think counseling should be tailor-made for every patient. And I tell my patients, read articles, listen to talk shows, read the blogs, but make sure that it is appropriate for you. And I think that's where the confusion starts, is whether this is right for me or this is not right for me. And there are so many books, there are so many articles, and I can understand why many people are confused. And then not only that, there are so many inputs. Mom brings in something, dad says something else, grandma brings in something else, the babysitter has his or her own version. And I think that's where parents have to sit down and see what is appropriate for their family and take it from there.